Welcome, 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 everyone. It is December 4th. Can you believe it, Dr. Gina? We are already at the end of this year.
I
I
can't.
cannot believe it.
How did we get here so quickly? Yeah.
I don't know, but if anyone, raise your hand if you're feeling how we are. That I always feel like after Thanksgiving, Christmas comes really fast. Just those 2 weeks just fly by, and it's already here into the end of the year, which is exciting as well. I just think kind of wrapping up 2024, getting ready for 2025. We're going to talk about some exciting things that we have going on. But we did have two of our fierce leaders in here. Dr. Gina, tell us what happened to Whit, our dear Whit.
Yeah. So he got, it's travel. Travel is unpredictable. That's all I know. He's on a plane and that's not where he intended to be tonight. I don't know the details.
Well, he's been a traveling nomad. He's been speaking all over the country. I do have to give him that. He is just on a mission to share our mission. I know he's been so active at least every week out there really spreading the word about testing. And we're going to talk about some of those tests, but from airway to pathogens to plaque, just really wants our dental community to understand that. And so we did have Dr. Hang originally planned for tonight on Airway, and he got hit by well, I say the hurricane because I'm from Florida, but the hurricane that turned into tornadoes and storms, and just they're kind of rebuilding.
Yeah. And he was not at all sure of, and I think felt confident they would not have internet. So he told us a couple of days ago, he's like, I just don't think I'm going to have internet. And indeed, they don't.
So here
Yeah.
we are. So you guys, we're going to have a little interactive night. We are going to still cover some of those topics, but from a different perspective, because we're still going to have Dr. Hang on. He's picking another date.
Yes.
I know our next one will be, remember, we do every other month. So we're going to be skipping here in January and we'll be heading over in February. We're going to have Holly Moons on and we're going to be talking kind of, I say, all things from hygiene to specific pathogens, and we'll be sending that out so you can capture that. She was one of our leaders that wrote too from the hygiene perspective on nitric oxide and airway and pathogens. So her kind of bringing that all together to our community will be very exciting. So I am going to go ahead. I'll share our screen. I know a few people are still coming in. We'll let that happen. And I hope, love to hear, maybe drop in how everybody's Thanksgiving was. Anybody have a great Thanksgiving story? I know Gina was asking me, and I did have my 80-year-old parents here, 80 and 83. I'm aging myself as well. But haven't had them in my home. I've been going to them for quite a few years. So really my story is just so much gratitude at Thanksgiving. I always cook and everything, but I think just, being able to serve your parents, have your parents. And for me, that was just a gift to get them to fly across the country all the way from Nevada. It was a long trip for them, but they did really well. And so I had a wonderful Thanksgiving holiday.
You had a house full, that's for sure.
Yes, I did, which I love. If anybody knows, yes, my 5 kids and then 2 more adults with my parents and kids and their significant others. There's never a dull moment or an empty spot anywhere in the house. It's trying to get you, Dr. Gina, to fly over here.
I know I wanted to, but I ended up staying in Texas and I had a wonderful, but very quiet compared to your Thanksgiving, but it was lovely. Just what I needed.
Well,
We
we're going to be
we have a
talking.
92-year-old relative that my dad's companion for the last 20 years of his life, and she's losing her eyesight. And we inherited their 2 little dogs when they moved into assisted living. And so before she lost all of her eyesight, Midge and I got in the car and drove to Southern Oregon so that she could have a chance to visit with her little dogs before she couldn't see them anymore. And so that was really fun.
Oh,
Oh, that's a beautiful story. Oh, that was so special.
It was
Oh,
great.
mm, 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 mm.
Dr. Steve, you're going to be adding to us tonight. Since we're missing Dr. Hang, I'm going to say you're going to be, hopefully we're going to be talking about some sleep and sleep biohacks. So I'm going to look to you and our community out there to add to that, because that's really what we want to do tonight, is why I opened with the holidays, is how do we get through the next holiday? Are there some biohacks that we can do just to make them more pleasurable? But I love Dr. Steve sharing that, because to me, that's one of the things, like, what can we find gratitude in? And some of that is looking to our elders, just how they've lived their life and how they continue to live their life, and that what do we take away, good or bad, and add to that. So we are grateful for all of you, and we're very excited where 2025 is taking us, because it is going to be a year. Our focus is on giving back. We're going to be creating a lot of new courses, and a lot of it's going to be around clinical implementation.
Yeah, everyone should go to the website and look around. But right now, Lora has her saliva test, Secrets of Saliva, on there. And that's an excellent course. And we're going to be adding to that in the year 2025. A lot of new courses coming out. Yeah.
And that's going to be our focus. Just we're going to be doing some live coaching online, kind of giving you some other options besides recordings, things like that. But look for new recordings and updates.
Yep.
And just bringing some new science. That's really going to be one of my hot topics, is giving back as far as trends, topics, and science. So what else is new going on? I want everyone to know about the ADA. Also go visit that, be a champion for overall health. The ADA Symposium is all about going to be embracing testing and dentistry's role in complete health. As many of you know, we were there last year for the symposium, and we will be there again next year, and we will always be supporting that. I think their main focus, that we make people healthy, everyone can get behind that, and just really seeing what the ADA's initiatives are going to be is just fantastic as we move forward. So check that out as well. Wanted to start with some new things that are going on. If you missed those highlights, don't want you to miss that in 2025. And for all my hygienists out there, I want you to know what the American Academy of Periodontology has going on as well. If you missed this update, they do have the AAP Dental Hygiene Engagement Initiative. I am part of that. I am going through that. I think it's fantastic as well. And so I just want to bring these things to you guys to see that where our industry is moving, that a lot of times we're like, oh, the ADA or the AAP, they're behind or they're not keeping up. And we can all have comments about that, but I want you to see they're trying. And we are out there trying to support those initiatives as well. So I hope you'll check that out and see where the industry is going, because this whole integrative dental medicine is really taking hold, and we're starting to see it in all our bigger, what I call, like, components and legislative. So it's moving in the right direction. Anything you want to add, Dr. Gina, on those?
I don't think so. I think it is exciting that, as you say, we see several arms of both dentistry and medicine moving in the right direction. So I expect big things to happen in 2025 around the two sides of the aisle, as Whit likes to say, coming together for the good of the patient, which is so apropos for our topic tonight, because we will not see the heart attack rate drop. We won't see the stroke rate drop. We won't see people actually get healthier, even though I know that's a campaign for the new administration for the United States of America, but it will not happen without dentistry and medicine coming together for the care of the patient, as we hope to demonstrate tonight by, we keep moving airway and oral health up and up and up the list of root causes of these diseases that none of us want. I mean, we've all been doing it for so long, everyone on this call, that we know that to be true, but it's still, you get such a like deer in the headlights look when you start to tell somebody that has no concept of that. And there's a lot of misinformation out there. So I'm glad that, you know, this is everything is changing. We'll see things blow up in 2025.
Yeah, and so just like I said, want to bring trends and highlights and things. And a lot of people miss this article. Of course, I'm going to talk about testing and my love, microbial testing, the oral microbiome, and just want to show you from the AAP, again, our Journal of Periodontology. This was posted back in February 2024. Yes, if it's hurting your eyes to read that, what I want you to see is that they're really talking about how we're kind of been missing the causative agent, this complex microbial etiology of periodontal disease. We see it right up top. That is the cause of periodontal disease, and that we've been overlooking the well-established microbial etiology. What are they talking about? Well, they're talking about how important it is to be testing what we've been talking about the entire past few years, like Dr. Gina said, how important that is. And what I love is that they're saying, yes, we're highlighting their value and broadening the periodontal assessment. And as I highlighted below, as you can see, because dysbiosis precedes periodontal damage. And I think that's the biggest takeaway. The reason I threw this in here tonight is I have to tell you, every day I get on, I do a lot of complimentary review of saliva tests across the country because it is my passion. You know, people have hard cases and sometimes they just want me to look at them. And I will tell you, Dr. Gina, I tell you this all the time. It's like, I just like, I want to plaster it on every billboard. I have dental colleagues come in all the time and say to me, this patient doesn't have any bleeding or pocketing. How could they have these red complex? How could they have these pathogens? And it's like, we forget the science. So I just want to keep putting the science out there over and over and over again. If you sit there and think that somebody has to have a sign or symptom so severe that you see it, that's the only way you're going to believe it, then you've been missing out, I say, in healthcare, because that would be like us saying, I say all the time to people, Dr. Gina, they'd be like you and I saying, well, somebody doesn't have cardiovascular disease till what? They have a heart attack, or somebody doesn't have high blood pressure until they actually have a stroke. I try to think of all these analogies. What did I tell you the other day? I said, I'm going to start saying this is
like a blood disorder, like lymphoma or something. Unless you test the blood, the person can look perfectly fine. And yeah, this is exact same thing, because we're talking about an abnormality at the cellular level. Of course, we can't see it, but that's where disease begins. And that's where we start to unravel disease and create health, is at the cellular level. So we've got to start thinking about looking through new glasses and absolutely closing our eyes and not looking at all at what we've been taught to look at all of our life and what we're so used to. That's the knee-jerk reaction, right? In both non-dental offices and dental offices, is to just look at the individual and make a decision and move on. That's really, that isn't going to lengthen anyone's life. It's certainly not associated with longevity medicine, age reversal medicine, or cellular medicine, which is very exciting these days, because that's how people are going to live longer and feel better and avoid these diseases, or we're going to turn the disease around. So you're right. Dentists and dental hygienists are at the forefront of that.
which I think is really cool. Instead of, sometimes I get like, I just want to scream every day. Like today, I was having the same conversation. I have it memorized. The Journal of Periodontology from 2008. I think I can tell you page 196 through 208. It talks about exactly how we have red complex pathogens and in a 1 to 3 millimeter sulcus. There's nothing magical about a 4 or 5 millimeter. The pathogens are there. It takes time. But my point is, this is just an exciting time that we can start talking about it differently. I keep saying, is this preclinical disease? What type of terms can we use to help really everyday clinicians? And that's what I'm looking for. I'm looking for our community to help with that, help other people understand that, because it's really beyond just microbial testing, because we're going to get into sleep testing. It's the same thing with sleep tests. Until somebody again has a heart attack or falls asleep while they're driving, do they not have some sleep disorder breathing? Well, of course, and then we can start looking at signs and symptoms, but it's the same thing. Well, if they're not showing me all those signs and symptoms, does that mean they don't have a sleep disorder? And I think we need to just start broadening that concept and that communication with each other so that we can start talking about it differently. And so I just want to show that, because tonight is all about putting your oxygen mask on first as we head into the holidays. We're going to talk about some of these hacks, some of these things that we can be doing, even beyond testing, but with testing as well. And during the holidays, we're always giving to others, and I think that's so important. But I also always ask, okay, we're getting ready to start a new year. What am I going to do for myself, right? What is that New Year's resolution? And I always make one for my family, and then I make a personal one. And so I hope tonight maybe that inspires you to think about the challenge we're going to throw out you at the end of tonight, what you could do for yourself and really to embrace it and engage with us in the community to help support it, because we are here, I say, to help ourselves, but to help, then I know if I help you, I help your spouse, I help, just as our Steve and I, we're helping our parents, we're helping our children, and that just keeps expanding all the way into our patients. So I put this on here because I think it's very true. I don't know if anyone had heard my story, but I was flying home from where were we? In Reno in Nevada, and they were telling us how the airplane was going to be dropping, right? That it's going to be very bumpy and that the oxygen mask may come down. And so you kind of prepare yourself for that, right? I've been on enough flights. So I was like, oh, no big deal. But I'm not gonna lie, the moment it happened, I did like panic. Even though I know we're not crashing, I think just in your mind, you're like, is this really happening? Feels like a movie. But what I do have to tell you is as I slid on my mask, I was like peeking through, you know how you can see through, and I saw a young couple in front of me, and it was probably I would say an infant, but like not quite a year old. She was younger, kind of curly hair, but she's totally asleep, just out. You could tell, just out, knocked out. That's a long flight, and the baby was knocked out. And I watched the dad like put his oxygen mask on, and then his wife, you know, on one hand, he's putting hers on, and they're kind of trying to talk. So I was kind of giggling because they're like screaming, so you could hear them.
Jesus.
And the baby is still sleeping. But what I was totally taken back by was the fact that they were like yelling, like, should we try to put the oxygen mask on the baby, like pulling the other one over. And so, of course, the father's trying to get on, and this child wanted nothing to do with it. I mean, you know what it's like to wake up. I say a sleeping baby is not good, especially on an airplane, you know, arms flailing, you know, pushing the whole thing. And I was just watching the dad trying, but more importantly, then he was just like holding the mask there. And I was thinking, this is the moment, because if he wouldn't have put his on, he would have never gotten his wife's on, and they would have never been able to manage the child. And it really opened my eyes as we're ending this year, going in the new year. Like, yeah, are we taking care of ourselves so we can take care of others? Because it is so important. And though it wasn't an emergency that we were going through, it was a great exercise, I think, just to remind myself as well as others. I'm sure others were witnessing that because they were very loud, panicking, but you know, trying not to panic because it wasn't like the plane's going down. But I think they're just worried, like, does the baby need oxygen as we're breathing? That's what they kept saying. And the airline attendant was like, it's okay, it's okay. The chambers aren't, you know, changing. It only does that when we change. She's trying to explain it. But I want you to just take a moment and think about that. And as we go into the challenges, can you meet that for yourself? What can we do for ourselves? So our topic is airway to pathogens to plaque. You've heard us talk a lot about that. And I think it's really understanding the connection. And I always admit, in my 30 years, I missed the first piece. I missed airway. Yes, Dr. Steve, all of them could come on here. But I hope there's some hygienists and dental colleagues that would raise their hand that said, hey, Laura, you're not alone. If you're out there, raise your hand. Say, I'm not alone. I can't be the only hygienist that was like blind that airway had anything to do with my oral microbiome, or what Dr. Pritchard is talking about, the cells, like the GI tract, the impact it's having on the body as a whole in the systemic system. Just totally was like, hey, stay in my lane. I'm just gonna look for bacteria and I'm just gonna clean teeth, right? Don't confuse me with any facts. And it really opened my world that, hey, the airway has such a big impact on the oral microbiome, and it completely shifts and changes that. And then, of course, Dr. Gina, that just, all of that is your entire world when you're looking at the entire oral systemic health of a patient. We can't ignore any one aspect. So I want
Yes.
people to really think about that. Make sure that you do understand that in healthcare, because I think it is the greatest secret. I think we don't talk about it enough as a pathway or its connections, because there are multiple variables or connections through the pathway. But I like to think about it very circular, that, right, if I have airway and I have some type of sleep disorder, breathing, desaturation, I'm shifting that oral microbiome towards a more pathogenic one. And once I have these pathogenic bacteria, specifically those red complex, we talk a lot about that PG, Porphyromonas gingivalis, that TD, Treponema denticola, that TF, Tenorilla forsythia, they can cross any lining of the body, and that really then impacts these vascular plaques. You want to add to that for me? What do, because we're going to talk about these, talk about the biometrics. We talk about these 5 Bs together quite a lot, how that's connected.
Yeah, one of the things that makes me think of is when you were talking about salivary testing, is in all of these categories, whether we're talking about airway or we're talking about the oral microbiome, and even what we're going to talk about some tonight, like pre-diabetes and insulin resistance, these things that we can't see in medicine in the critical care unit, we would put sleep apnea like it's not a problem till it's sleep apnea to a moderate or severe degree. And so honestly, I remember a day, and remember, I've been doing this a long time. And I remember a time when a person would have to come back for a second or third stent procedure, maybe even their second or third heart attack, before we said, we're missing something. What have we not looked at? Oh, we better send them for a sleep study. Maybe they have sleep apnea. And we would feel kind of silly doing it, especially if they weren't a 65-year-old or over male that was overweight with a large neck. We're like, well, but we've looked at everything else. The last thing we looked at. And so I know we started out the talking about that. And now it's like the first thing we look at, the first thing, because we know in children and in females and in thin people, it doesn't matter. And it can take just a little bit of oxygen dropping at night a few times before it's the full-blown classic definition of sleep apnea to impact someone's vascular health for sure, and create not only risk for stroke, risk for heart attack, risk for all the diseases that we don't want, and diabetes, which we're going to talk about tonight. So yeah, that's number one of the 5 Bs that we start with. Everybody that comes into our practice, step 1, gets a sleep analysis. Of course, at home, the technology is so good these days to be able to understand a lot of what's going on by doing a home sleep study for multiple nights. Yeah.
And then that leads us, it's a saliva testing, which I just want to say, tonight we're not trying to skip over that, just say a little bit, but I just want to add, I almost wish I could go back now and say how many people had an airway disorder that I was trying to blame their oral condition, even when I did see the signs and symptoms, not making the connection. And I think about the dramatic people, right? The people who, obvious mouth breathers, have the red tissue, the dry mouth, but how many other people don't have that sign or symptom yet, or like you said, they're on what I call like the spectrum. They have some type of disorder and it is already affecting then the second layer. The oral microbiome is shifting from an aerobic to an anaerobic one, or what you can also be saying to very acidic to acidic one.
Yeah, and of course, we'd love to study if the pathogens look totally different in someone that doesn't have an airway disorder, but it's so hard to find someone that doesn't have, most people have some sort of sleep disordered breathing from an airway issue. However, that would take large groups of people anyway, but we know from the literature it's definitely true, and we've certainly seen it in clinical practice. Yeah, and then number 3, buildup of cholesterol and debris in the wall of the artery, leading to plaques in the endothelial lining of every artery in the body. But of course, most importantly, those in the heart and those in the brain. But I say most importantly, it's just not talked about as much, but it's really equally as important, the blood supply, obviously, to every vital organ, the kidneys, the liver, the GI system, etc. And so I approach it a little bit from reverse, because a lot of people say, I just want to know what my heart looks like am I at risk for a heart attack? So we start with number 3, if that's where people want to start, like give them what they want, right? And then we lead them to what they actually need, which is, well, why is it there? Because it is also very hard to find somebody that doesn't have plaque, certainly over age 45 and 50. And So that leads us back to step 1 and 2. Of course, most of us have plaque in the wall of the arteries. In our practice, Laura and I have had one patient, a 50-year-old female, that had 0 plaque. Everyone else in the practice has had some plaque in the heart arteries of all magnitude, a little bit of dangerous, or a little bit of moderate or low risk, and a lot of high risk or moderate risk or dangerous. So this is definitely the order to do it in. It's just a lot of people in the non-dental office will say, I'm worried about my heart or my brain. And then in the dental office, what a wonderful opportunity to go right there when they come into you for airway or for, salivary diagnostics, or you educate them on the fact that they need salivary diagnostics. And then you say, this is leading to big problems until proven otherwise. We have to do an evaluation of your vasculature in some form or fashion, whether it's ultrasound or CAT scan or otherwise.
Yeah, so write down those 3 Bs, because to me, this is about implementation. If somebody comes in on their medical history, I see they're on, we can name the medication, a cholesterol medication, high blood pressure medication, diabetes medication. I'm thinking plaques, cardiovascular disease, right? So I can start there and say, hey, you're really at high risk for periodontal disease and creating these pathogens. You're very at high risk for sleep disordered breathing and an airway issue, right? So they can go either way, or somebody comes in and they're complaining about their sleep, or they checked all the boxes on your questionnaire and you start with that sleep, or vice versa. They come in and you're going straight through pathogens because they have periodontal disease. So I want you to kind of think about this as like, it doesn't have to be 1, 2, or 3 and in that order. I just am always saying that to you because to me, I felt like, oh my God, I missed number 1. I missed number 1. They're not breathing, they can't come in. And that could set off the whole cascade of everything. But I want you to really be thinking about like, okay, am I looking at these 3 Bs? We're going to add the other 2. But I think if you're looking at every patient, did I look at the 3 Bs of the patient? And it could be simply in a dental practice every day, airway, the oral microbiome, and hey, what is that medical history? Do I know what their medical history is? Because we know cardiovascular disease is our number 1 killer. So we know just about every patient that's coming in has some level of risk. And then, of course, I'm just going to run through these quick. Dr. Gina, our blood panel, we're not going to get into that really tonight, but those are how, again, these screenings, these tests can really help us. And we go through that. And I always like to bring up the body, even though in the physician's office, the body's going to look different, right? Waist measurements. And we're going to be doing, getting on the in body and knowing how much fat and hydration and muscle mass and all that. But I say minimally, we could be doing body. What does the body look like a little bit on the inside? Is getting that cone beam. What does the airway look like? What are their calcifications in those carotids? What do their sinuses look like? Like how healthy are they breathing? What else is going on in those areas that we should be screening for? So these are the 5 Bs kind of run through over and over that we talk about just constantly in our conversations on every patient. And I wanted to add for everyone, this Tuesday, we had a 47-year-old male come in and he wanted to talk and have a consultation because his very best friend fell over and had a massive heart attack. He actually died. They resuscitated him and it sent off a ripple effect. He said that this patient that had the heart attack, his friend, it really broke my heart. His wife's like in functional med and they're like, he's the last person that should have had the heart attack out of all their friends. So this guy's kind of telling us he's young, he's 47. He's like, he's the last one. His wife makes him eat and exercise. And it just kind of broke my heart. Again, the same story that we're hearing, because on the outside, he looks so great, yet on the inside, he was very sick. But kudos to our patient who came to us on Tuesday because he said, I need to know. And so Dr. Gina was sharing that with you because he said, I want to know what my heart looks like, right? He is starting at 3. He's like, I just want to know if I have plaques. I want to know. That's my best friend. If he's like that and I'm not as healthy as him, I don't feel like lifestyle and diet. Am I going to do that? And that fear was his drive, which is unfortunate. But I think until that happens to some of us, we don't realize how real that can be. And it was devastating for a lot of their friends. The good news is the man did survive. I think that's the caveat in all of this. The kind of silver lining is that he is telling all his friends to go get screened. And I just had to share that this week because that does happen to us a lot, Dr. Gina. But again, I think having younger patients tell that story or come in is really important in this day and age, that we're not kind of just overlooking that. And again, thinking we have to be older to have these issues.
Mhm.
So decrease in oxygenation, I just kind of want to make sure we all get this. You know, I used to skip over saturation. I used to just go to the, is there an AHI? What does the doctor tell me? Okay, you're mild or moderate, you're fine. And what I realized is studying the oral microbiome, that the desaturation, just the decrease in oxygenation, was way more important for my pathogens than anything else that is on that paper for me. Is that, oh my gosh, if they're desaturating, it doesn't have to be a whole lot, just these desaturations happening, that is shifting the growth of the bacteria. And when that shift happens, we start to maturate and grow these very unhealthy species. And when unhealthy species grow, because bacteria fight for food and space, we're losing the healthy ones. And when we lose healthy ones, then we start losing nitric oxide, and we start losing other very important species that happen during digestion. Like, I'm just going to name Rothia, that helps us break down gluten. And so there's all these kind of cascading events that happen. And so again, just coming back to having some type of sleep screening in your office is so, so very important. And I just want to scream to all the hygienists, don't be like Lora. Don't miss this. Just pause here and don't miss it. Because a lot of times we're pointing the finger at the patient that they're not brushing and flossing. And all of a sudden, I'm going to say I had a lot of guilt that it wasn't about that. It might have never been about that. And I wasn't having the right conversation, and I needed to have a airway conversation with these patients. So I just want you to kind of star that and remember that as you head into the new year, how you can be looking at your patient differently. So what can we do to work up airway and sleep? What are some of you guys doing? I'm actually going to stop. I want people to be able to come off. What are you doing currently in your practice to evaluate that?
Anyone in the chat or want to speak up, just unmute yourself, raise your hand, whatever you're most comfortable doing. All right. Yeah. Dr. Nora, is she?
Hey, yeah, I'm from Connecticut, and way back, I forgot when, just looking at the obstructions that are in the oral cavity and saying, hey, you got tori, you got a high arching palate, and that's decreasing your nasal airflow. Looking back at the throat and saying, hey, look at those tonsils, they're 10 miles wide. I can't even see the uvula hanging in between them because there's no space there. Looking at the scallop border of the tongue, various things like that, just crowding that, we every day see, and we just think, oh, we got to send them to the orthodontist, get the teeth straight. But God Almighty, we're making space for the airway if we do that. And the connection, Lora, you just made, I'd never had to put the thing together. Yes, you desaturate the oxygen, and all of a sudden your biome is going towards an anaerobic biome. So that's something new I'm going to bring to my hygienist tomorrow. It's like, this is so important. It is absolutely important. Not that I haven't been saying it, but saying it with those words, a new point of view, I think is going to make a big, big difference. So thank you for letting me chime in.
Love it. Thank you. And I think it's a little easier conversation than me telling somebody, gosh, you got to keep brushing and flossing. Of course, we're going to say that, but hey, let's find out if there's a bigger root cause to the story. And I think that's where my conversation started to go differently. So love it. I loved all the things he named. Dr. Steve, if you could unmute yourself, I'd love for you to add anything on there. I know we're talking tori, right? High palate, crowding, Palamati, can't see the uvula, all those things. I think it's great to take pictures, but anything you want to add on there?
Well, one of the things that people rarely do is they rarely connect the structure of their mouth with how their airway performs. And so as we point out things like that they can easily see, like crowded teeth, or even if they can tell their airways, feels a little plugged up or congested. And we can say, that all has to do with how you're put together. And nowadays we can understand that not only can we address structure, but we can address function really well. And none of that separates from microbiome, which they're hearing more and more about. And so as we start to weave all of those pieces together, it's kind of fun when I see a patient go, I hadn't thought about that before, you know, and or nobody's told me that before. I mean, I hear that so much. We all hear that so much, but those are fun conversations to have. Yeah.
Laura, can I mention something?
Yes, Dr. Steinberg.
Yeah, okay. So many times I'll see just a bite wing and I'll say, this person's not breathing. And or probably it opens up questions, because when you start seeing interproximal bone slanting towards the distal, going down on the bottom and up on the top, they're clenching. And why are they clenching? And it just leads to a bunch of things. So I get cocky and I can say, I can tell he can't breathe from a bite wing. I sound like like an old voodoo guy. But more often than not, it's not gum disease. A periodontist might say, we're going to fix that with surgery. But it's many, many times I'll see that and I'll say, anybody tell you snore? So yeah, my boyfriend says I snore all the time. And it opens up the whole conversation just from a bite wing.
I love it. I love it, because that's what we're talking about, using our tests, our diagnostics to open that conversation, to have a different conversation. So I love both. Like Dr. Steve saying, I love the wintertime. People are all congested. They can't breathe. They say, oh, I can't lean back because I have, sinus postnasal drip going on. And I'm like, oh, tell me about that, right? To just like you're saying, Dr. Steinberg, to taking x-ray to say, hey, we're losing bone. And I see how this bone is. Like, I think you're having, could be, how are you sleeping? Being able to open that up. Why is that happening? What is the root cause? Are you clenching, grinding, and then being able to show whether you can see it on a radiograph or taking a picture of those marks, right? When we see that from adfractions to wear to the grinding, I think it's just all great ways that I think clinicians, I love to talk about implementation, because we kind of talk about these concepts and then we look at a patient, we're seeing it. Like you said, I'm seeing it on an x-ray. I'm seeing it on a cone beam. I'm seeing it. I'm having a conversation with them sometimes and being able to put it together. So love that you guys, and just want to be able to do that. This year, we did talk about a lot of ways to sleep screen, but I actually am going to share my screen here because there's a few too, that a lot of people don't know about. And in my world, when I first started, I did not work for a sleep doctor. I did not meet Dr. Wilkerson. I did not have the pleasure of working with him right away, even though I work for some very exceptional dentists. I'm going to say that was not, I'm going to age myself again, 30 years ago, that's just not where we were. And there are hygienists who come to me all the time and say, Laura, my doctor's not doing sleep. I don't know what to do. How do I I can't force the issue or force the hand. And so I want to talk about that as well, because there's been 2 companies that we've been using that we're going to talk about, but I also want to talk about just things that we can talk to patients that are free, that are valuable, whether we are doing some of these things ourselves already because they are part of our sleep program. We can talk to anybody about going on from Oxygen Advantage to just find a good myofunctional therapist you like on YouTube. A lot of them are free. Talk about good sleep hygiene habits, right? Cool room, get off your technology before bed. That's why we got to be done by 9:30. We got to have that time before we get in our beds. Right. Making sure that we're following those things, mewing. A lot of people, that was a big thing. I've got 5 kids, mewing was like a big joke in the house. They were going around talking about how, oh yeah, kids can't talk in class because they're mewing. They're putting their tongue, on the roof of their mouth. They can't answer a question. And so people are doing appliance therapy and looking at that. There are things that we can get online that can even help patients. But, I always I have to give kudos to Dr. Wilkerson. He's always holding up his mouth tape because it's so simple, so easy to do, to really help people. And then I like to talk a little bit about supplementation, Dr. Gina. I think we kind of skip over this a lot, and there's 2 on here that are just hit home for me. But talk about these supplements that just help with sleep specifically.
Yeah. So, for one, D3, whenever you take D3, you always need to take K2 with it for D3 to help mobilize calcium into the bone and other places that it needs to be, and not deposit in places where you don't want it. So D3 and K2 together. Nitric oxide supplementation is so important we've seen it dramatically lower an individual's blood pressure, more than one. I mean, numerous patients, lowering of the blood pressure because of its effect on the arterial health. And so anybody that you're even just seeing the bite wing problem you were talking about earlier, or the other signs of, an airway disorder, they have an impairment in their nitric oxide pathway. And so you can easily recommend nitric oxide supplementation, and especially if they have high blood pressure as well. That would be your go-to. Magnesium to help with blood pressure as well, and also for, improving sleep. And salt has really gotten a bad rap for increasing blood pressure, and we know that that is not true. And so most people are dehydrated and are on the low side in terms of salt. And that's not everyone. And of course, Laura and I are seeing the blood test results on a daily basis, but a lot of people would benefit if they would add more salt to their food, and even take it as an electrolyte. If it's a healthy electrolyte, you don't want them adding toxins. And then hormones. Oh, I could spend the next hour talking about the impact of optimizing your hormones on not only sleep, but improving the benefits of what we're trying to treat with the airway disorder, if you're also optimizing hormones at the same time. Yes, go ahead, Dr. Noeji.
You mentioned salt and hydration, and we see so many people walking around with plain old water, that they're deionized or whatever they've done to it. And now they forget that they're a battery that doesn't have any minerals in it. It's not going to be a battery that's running anymore. So I've been augmenting what I talk about with my patients, especially in the wintertime. We see dry lips and we know that they're dehydrated, is instead of licking their lips and sucking the water down, to use some kind of electrolyte base. Do you have a recommendation for that, what they should be using?
I do. And Laura and I need to post on IDM. There is a homemade one that you can make that's the least expensive way to go, and you can kind of adapt it to your taste. But the LMNT has gotten a bad rap because they said there was no maltodextrin, and then now there apparently is a little bit of maltodextrin, but it's a very pure one compared to most of these electrolyte drinks and mixes. So you really just want no other ingredients except sodium, potassium, and magnesium. Maybe some people have put a little bit of like baking soda in there, or sodium bicarb or something, but it's really not necessary. Magnesium, potassium, and sodium. And so you can make it easily at home. There's another one that's called salt of the earth. They're powders that come in packets, and you just put it in water. That's the best way to go. Or if you wanted to put it in a little bit of tea or something like that. But most of the ones you buy pre-mixed, even the LMNT, if you buy the pre-mixed, it's full of toxins. There's like sweeteners that are not healthy for you. Even though there's a stevia, it's not the good kind of stevia. Some stevias can be okay, maybe. But so I recommend just the packets that you see. There's nothing in there but potassium, magnesium, and sodium.
Very good. Thank you, ma'am.
I just want to say how important electrolytes are. And I just, like to tell stories because I was that person. Female, yeah, we can blame hormones, but honestly, Dr. Gina's like, you need salt. I had like no sodium. And of course, that affects my potassium, my magnesium. I have headaches. I couldn't go to sleep at night. And it's like, we get on these vicious cascades where, is it the chicken or the egg? And to me, it's just such a simple thing and can drastically help so many patients. They're not even aware of that. And I loved what Dr. Norji is saying, is that a lot of people are drinking a lot of water, hydrating, and we're actually diluting our electrolytes. I was the guilty one. We think a really good thing. And I always try to tell myself, like, sometimes too much of a good thing isn't a good thing anymore. So I like what you said, just getting a good pure mineral salt, a Celtic salt, and putting it even in your water. And that's one of the things I tell people all the time. I was just putting it right on my tongue, to be honest, when I'd get really bad. And I started hormones there because even Dr. Gina, I want you to talk about what are the precursors for hormones? Because maybe somebody doesn't want to take hormones, but what are those supplements that help support the hormones? That's kind of where I was going with this, with the whole electrolytes and magnesium and everything.
Right. D3 is, and then all of the B vitamins, but none of the B vitamins less important than B12. DHEA, although I've become, over the last 20 years, I've become slower at recommending DHEA supplementation, but that's sometimes an option. Yeah, all of the the electrolytes that we just talked about are important. So you've got to have those cofactors to take your pre-hormone state to the hormone level. So you're either end up with unusable hormones because it goes down the wrong pathway, or you don't build the hormone like you should without those precursors. But if I had to pick three, I would say D3, which of course you're always going to take with K2, and then B12 or B6, B12, and folic acid or folate. And thirdly, I guess I would pick electrolytes. Actually, we didn't think about that. I mean, or maybe you did when you put this slide together, but yeah, I would say sodium, potassium, and magnesium.
Yeah, so I just want to talk about that a little bit with sleep, because most of us aren't going to talk hormones or go there, but we can be talking this way of how to help somebody with their sleep. Kind of directly know that a lot of women, we know that either pre or post-menopausal are having a lot of issues with sleep, and you just giving them the information of these cofactors, helping them can really drastically change people. And I say men as well, because the nitric oxide, I'm going to say, right, we know that helps all of us, but also just the fact of us getting these precursors, even with testosterone. Remember, that's our happy hormone. A lot of us need that as well as we're going through. So I just wanted to add those things. So let's talk about some of these other things. Kim, can you help me with, I don't know who's drawing on my screen, but how that's happening. But I just want to say shortages of sleep, why oral is systemic again, is they are directly connected to diabetes. You don't get enough sleep, and we're going to talk more about that, but also depression, heart problems. We talk about high blood pressure. And this is really important, lowered immunity. In my world of testing, with saliva testing, we talk a lot about viruses, why viruses express, and that is the host response, the immunity. And a lot of times I am saying, how are you sleeping, right? You can't fight off this bacterial infection of periodontal disease because you wake up 5 times at night. Again, I said it always comes back, right? To sleep at the end of the day. They're stressed out. They're, not as healthy as they should be. So just keep those things in mind. And then I have obesity on there because it is an epidemic in our country. And again, we see that as sleep. That is somebody who's not getting enough sleep and not be able to go through that correct pathway. And so I wanted to bring up these two businesses, and we do not get paid by anybody. We talk a lot about others, and I don't mind Steve dropping some things in there, or other people. But these are two, I'm going to come back to my conversation with hygienists, because if they are in a practice where you say they're not doing sleep, my doctor doesn't want to take that on, what do you do? I felt handicapped at one point. And so I really liked people to know about Empower Sleep, because you can just refer your patients to Empower Sleep. You put their information in there and they do it all for you. And it is by sleep doctors. They're Harvard trained, and they have myofunctional therapists. They have nurse practitioners. They're on there, and they're going to help the patient all the way through. If they need a CPAP, to telling, hey, go back and you just need an appliance. And so somebody who doesn't want to have maybe a robust sleep program, this is a great solution. And I also want hygienists to know, right, don't ignore it. There are things you can do. So I really love this for my adults. And so take note of that. Love for you to go visit that. And they really do a fantastic job. They have a great report. And the same thing with our good friends there at Tooth Pillow when we're talking about children. I also have a lot of hygienists who come to me and say, I can't do sleep. We don't do children. We only do adults. And so again, this is so important. Dr. Steve, I'm going to make you talk again because he was talking about our anatomy. And if I could go back 30 years and start over, this would be one of my passions, because I'm going to tell you, with my 5 children, I missed this on the first ones. I did very traditional orthodontics, and now, I have 24 to 14. Now with my 14-year-old, I'm like, oh my God, I can see it. Dr. Steve, I couldn't see it on the 24-year-old, but now it's like, the pushback and the crowding, and, we did traditional ortho and just pulled all the others right back, giving them an airway problem. So could you just talk a little bit about this? Because you're kind of stemming from that. And I think it's just important. I just want hygienists to know, hey, if you're not doing it in your practice or other areas like you're doing, at least I want them to know about this. But just tell us a little bit about the anatomy here and why it's so important with children.
Well, it begins with we think about ourselves or our patients that are 55 and breathing badly and suffering from long-term chronic diseases that they've developed over the years. And we think, well, gosh, how did they get this way? And in the early days of sleep, they never talked about how they got that way. They were just focused on treating the symptoms and treating the disease and supporting the airway, CPAPs and things. But now, as precision medicines become more and more common, and this talk's all about precision medicine, then we our minds turn to, well, what happened at 5.5? And then we realize that only dentistry and especially hygienists can see those problems at 5.5 or 3.5 or 0.5. And we had this obligation in medicine to notice those things. And if you in your practice aren't treating underdeveloped craniofacial respiratory complex, that's perfectly fine. I don't treat that, but I know people who do. And so just like everything else in our community, if we don't want to do this, if we can't do this, we're a associate, we're a hygienist with no power, we're a member of a DSO, and the DSO won't let us do these things. Okay, but you can't not see it. You can't not know it. You can't be a good doctor without thinking, how do I get this message across? So find a partner. Could be Empowered Sleep, could be Tooth Pillow, great organizations, could be, any number. It could be the guy down the street, could be the woman in the floor above you. And find a partnership, make a connection. And if you're not in charge, you clear it with the leadership because you don't want to undermine that. But your leadership then can start to realize that, wow, when your patient comes in and you talk about breathing and sleep and all those things, but no, I don't treat that here, but my colleague down the street does. Oh yeah, your child isn't, things don't look like they're doing very well and they're mouth breathing all the time. My colleague over there does something with making sure that they can put their tongue in the right place. Then the families go over there and they get treatment. And then guess who's the hero? The person who made the referral. So it's still a positive for the practice, even if you don't actually do the treatment. And when we get that attitude more and more through our practices, through our colleagues, through our friends and the people that we talk to, that's when we can begin to make the biggest impact. Because it takes some extra training, takes some extra skill sets, takes some capacity, takes some dedication to provide the kind of services that we're doing here. And it's fun and lovely and it's exciting. But not all of our colleagues can do this. But we can help them see that they can be part of the righteous cause here and get the airways open from earliest age possible just by having the conversation, just by knowing the resources around them, resources available. Is that what you wanted there, Laura?
I did, because it opens the doors to ENT, to, like you're saying, even a myofunctional therapist, to somebody who just does tongue ties in our community. There's so many, like you said, it could literally be the person above us, and right, we're afraid, or we're not stepping outside. Again, I say that box instead of, like you said, be the hero, build the community. I think that's a huge message. I love that. It's let's not be afraid to talk to each other or the people who are right next to us, because a lot of us can't do everything, right? That's the other thing. That's why I always point the finger at myself. I wasn't doing a lot of these things, because it is hard to implement and be really good at, one thing, let alone a lot of things. So it's like, hey, if somebody loves sleep in my community, I want to give it there. But I also want to be, like you said, very open. Like, our communities now are growing because of technology. Look, just even who's on here tonight. It's like, hey, I want to go talk to Dr. Steve or Dr. Steinberg or whoever. It's like, right, that's what it's about, to help us be able to move forward. So
somebody in the chat mentioned an ENT. I love ENTs. I have great relationships with several ENTs, but not every ENT, because you have to find people that are willing to sit down with a dentist and realize that, wow, I have a peer here. I have somebody who knows a lot about something else that I don't know about. And not all ENTs are ready to have that conversation. And honestly, not all dentists are ready to have that conversation. So as you approach a colleague and you respect their position and their knowledge, and yes, we're not physicians, but they're not dentists. So don't ever forget that. claim your space, be your expert, but collaborate with the other expert. And now we have, instead of each having an apple, we have, more things to deal with. What's that? I didn't get the phrase right. If I have an idea and you have an idea and we put them together, we have more than two ideas. Something like that anyway. But the key is getting together with other experts and don't just say, I know I'm subservient to you, but please do something with my patient. But instead, let's work together on this. What an exciting way to practice.
Love it. Love it. I just want to share with the community. Thank you so much. And I think that's a great message for us to really stand by. So I want to know how many of you are actually doing any type of wearable to track your sleep and oxygenation. I have an Oura ring. Right. Some people, I know you got to see Dr. Witt. He used to always show his snore lab on his phone. Some people are doing that. So how many people there, Dr. Gina, are wearing something or tracking either their oxygenation? I know people have Garmin's now. I know one of my middle son, his Garmin like literally tells him from where he's going to, everything about him, what's going on inside. So I think technology is just becoming pretty fabulous. How many people are tracking?
This is a quiet group tonight. They're not chatting much, but Michelle says yes. Yeah. And two, it's also maybe because I'm trying to type the electrolyte recipe in the chat at the same time. I don't know if that's hampering it or people are being quiet, but says at 7:57, we had one person say yes, and that's Michelle.
Well, we're going to say that because again, I'm going to tell you to put your oxygen mask on first. If you don't even know if you have any type of sleep disorder, how in the world are you going to know somebody else? And I think it's really cool. There's from free apps that you can download to a lot of wearables, even your phone nowadays. So depending which phone you have, which generation. So I'm going to throw that out there to you because I've really, tracked mine over the years. I love Dr. Gina, we have patients, a lot of our patients say, I need a break from this thing. People will get stressed out. I love it because I'm like, oh yeah, I like when my phone's like, you need to rest today. I need somebody to tell me that. It validates, yes, I need to take a little nap and recharge. But I think the other thing is, are we getting that deep sleep for our brain, for longevity? Are we in REM sleep? All these things that become really important when we're talking about overall health. And so I just want to touch on, does sleep affect your glucose and insulin? And how about blood pressure? What would you say? How many people would say yes? Raise your hand. I'm going to stop sharing. I want to see. You can put your hand up on the thing. Does your sleep affect your glucose levels? All right. Does your sleep affect your blood pressure levels? Okay, those are two things. And again, I pick on our hygienists because that is such a big piece of the conversation as well. Remember, if I'm missing the whole sleep conversation, but I see high blood pressure, it takes me back to sleep, which takes me back to my pathogens. And I want to say the same thing with glucose. Those of you who know me personally have heard my story. My youngest son is a type 1 diabetic. I promise you, if my son wakes up and has a bad night's sleep, he is going to have a hard day tomorrow. He will wake up high glucose. And so we have to remember the impact that sleep is having. And so I always tell my children how important deep sleep is, that they're getting into sleep, and we can talk about that overall, but I just don't want you missing that. A lot of people will come in, and Dr. Gina, how many times do we hear patients say, like, I don't know why my glucose is high when I wake up? Of course, we're like, well, did it have anything to do with the past 6 hours or 7 hours? What happened? So what would you say about that, Dr. Gina? Because we really talk a lot about glucose and sleep with our patients.
Yeah, absolutely. It affects it. And of course, we know it's tied into the circadian rhythm and the fact that cortisol levels start to rise to awaken us in the morning. And of course, yes, your glucose is going to come up. And there are genetic predispositions too for variants of these things. So just for us to say that everyone is the same, we see over and over again that is indeed not true. The things that are going to increase your glucose and or insulin are different than mine. Some similarities among all of us. Obviously, drinking a Coke, all of us will have a blood sugar spike, but there are a lot of other things that affect it, and you've named a few for sure.
I know somebody asked about the nitric oxide, and this will also help both of these things. We know when you're getting adequate nitric oxide, so that could be teaching somebody to nasal breathe, right, with their mouth taping, getting them
Right.
back, doing good deep breathing, building that nitric oxide level up actually helps the glucose. We know that, and their insulin, the pathway, they're all connected, as well as a direct correlation of blood pressure. And I know that firsthand. I've gotten my 83-year-old father off of blood pressure medicine just by taking a good nitric oxide supplement. I am biased. I am going to tell you, I'm biased when it comes to this, just because of Dr. Nathan Bryan has made so many of the previous products, and he's on his 3rd generation. I really do like his new generation product, that N101. I don't know if you want to say anything about that, Dr. Pritchard. You've used lots of those products out there.
Yeah, there are a lot of them that don't work. There are a lot of them that have L-arginine in them, which is dangerous. You don't want to be taking L-arginine, or certainly not L-arginine alone. That's a myth that won't seem to go away. But there is solid research behind Nathan Bryan's product, and it works great. We've seen it in clinical practice. There's clear evidence that it does dilate the arteries. It does improve the health of endothelium. And so we recommend, and I'll put this in the chat as well, that individuals get either the N02U or the N101. They're the same products, both Nathan Bryan's companies, and the lozenge twice a day, or you can do the lozenge twice a day and then do the powders twice a day as well, if for people that like to use it as a pre-workout or just want that additional nitric oxide boosting. So that is what we recommend. Yeah,
So
the other thing I was
it's a
gonna
magic molecule. And so when we mouth breathe, we're losing that. And they call it the magic molecule because we're losing the nitric oxide. So I want you to see that. How many things just from whether, like me, you have a deviated septum and you can't breathe through your nose very well, to, right, you have all the other airway symptoms, and you're not getting adequate oxygenation or having some sleep disorder breathing. Just this simple first pathway of losing nitric oxide capabilities, you're then switching again. You have to have Neisseria rothia. Those are the enzyme. Those are the bacteria that produce these enzymes that make this nitric oxide, as well as using the nose to create the nitric oxide. So it's really twofold: our nose and our mouth. And especially our mouth breathers, they're just wiping that completely out. And again, then we're going pathogens. So here we go on that full cascade. So now we have 2 things working against our blood pressure. I don't have nitric oxide, and right now I have pathogens in my bloodstream. And oh, by the way, now my glucose is high. So, I mean, we can just stop there. We don't have to go any farther than that. And so this airway to pathogens to plaque, I just really want us to understand that as we go through. I won't spend any more time on that, but just people to really start to implement that, as we said today, into practice. What am I looking for clinically? What conversations can I have clinically? And then what can I do in my practice? Because if you have the services, like Dr. Steve said, then that's what we're there to do. And if you don't, that's okay. You have community, build your community, and you have people who can help you with that. So we're not ignoring that. And so we do have the bacterial shift. That's what we're talking about. So we're losing health and we're growing this red complex, that very isolated 1% that actually goes into the bloodstream there. And so how many people are tracking their glucose levels? Who's worn a continuous glucose monitor? Come on, guys, where are you? Who's worn one? I see a few hands.
Even
All
fewer that are doing wearables.
No, a couple no's. All right, well, we need to talk about this. This, to me, is life-changing, especially through the holidays. Let's talk about that. I'd like for you guys to meet Stello. I am a fan of Dexcom just because my son is a type 1. There's lots of studies. There are just validity tests they do on the accuracy. Why I'm going to bring this one up is because you don't need a prescription, right, Dr. Gina?
That's right. Over the counter, just order it.
They can go right online. You can go right to stello.com and you can order these. What is it? 2 for like $99. I think it's 15 days they last. And this is honestly, this is your gift to yourself for the holiday. You and a friend, or you and your spouse, put these on and let's talk about some biohackings. What I want to pull in here is, look at this. This is overnight morning glucose levels impacted by what time they ate dinner. So look at this evening one, they ate a little bit, closer to almost 8:30, and look how high they went. They backed that up, and then they ate closer to 5:30, and look how lower that was throughout the night. And we talk about that a lot, how our body is going into rest and repair. And so I just want you to see, this is one of the hacks. Again, eating earlier in the night, having a better night's sleep helps on such a cellular level. So what happens when you spike at night? Yeah, do you think you sleep very well? Do you think that's playing a part? I know people talk about restless leg and all these things. We talk about iron and iodine, but this, I think, is overlooked so many times, that people are spiking before bed because they just had dinner a few hours before. And remember, it's almost a 3-hour cycle. And so they're peaking at about an hour, hour and a half. And a lot of people are trying to go to bed, and your body is, what I say, in glycation. You're in resting, in panic, because you're spitting out a bunch of insulin because your glucose is so high. And so when it comes to longevity, and this was one of the first comments my Jack told me, is when we got in the car, he came home and he said to his oldest brother's 24, he's 14, he said, to Nick, that I'm probably going to die before you. And it just broke my heart, because the diabetes educators do tell them, and it is very aware to these children, that the more spikes you have, you're aging. You are, decreasing their life. So they told him that, yes, because you have type 1 diabetes, it cuts your life by at least 10 years. And so his oldest brother is 10 years older than him. And it just broke my heart. And so it's like, right, then you look in the world of like, okay, how can I manage that? How can I hack that? How can I not have my child be that average? And I really look at that now as a longevity thing, because they talk about that the more spikes we are having, the faster we're aging, or glycating, which is rusting, right? Dr. Gina, what would you say that on a cellular level that's happening to us?
Yeah, that's right. Yeah, you're baking at too high of a heat for many, many years. So you're slow roasting. That's right. And it's going to kill you over time, sooner than you would have if you didn't. Mm-hmm.
And I added in the mental health here because I have no shame in saying that when I don't sleep, I am not a nice person. And you start to put the story together. I'm not, I'm moody. What does that mean? My tyrosine was probably low. My dopamine's now low. My glucose is really high. My insulin is high. These are all cellular things. And we think that's just the person. But there is a lot around that. And so again, I'm bringing that up because on the holidays, I've been guilty of this, of like, oh, I'll catch up on my sleep later. And I'm sure Dr. Steve and our sleep experts would say, that's not really true, Laura. You're not catching up on anything. It's so important that we get that sleep. And I want you to just think about that. And I put mental health because that is something we don't talk enough about, and we see it, and just understanding. So anything you want to talk, I'm going to kind of go just about, REM sleep, deep sleep, anything you want to add to that, Dr. Gina? I know you're also on the Airway Revolution board, how important it is with the work you do, that you are part of that and really helping the community as well because of its connection.
I think the only other thing that I would add would just be, and we've talked all around it about being in fight or flight as opposed to the rest and digest neurologic state, which we're supposed to be in to get good, restful, restorative sleep at night. But not only is that's another way that we know that our blood sugar, of course, is going to be up, because your body thinks that you are like running from a bear, or there's some kind of crisis going on when you're grinding and clenching and struggling to wake yourself up to breathe. We see on these sleep studies, I'm sure all of y'all have seen this too, how the heart rate goes up, or maybe the heart rate goes up because the neurologic system, first of all, kicks in, raising the heart rate. And so you're going to require more blood sugar for that. So your blood sugar is going to initially rise, but then of course you're going to crash. So it's like there are so many nuances at play, from the neurologic to the cardiac system to, blood pressure, that and hormones, and then your body is just struggling to get good sleep. So I think if we think about at a cellular level as well, being in fight or flight all night long is just like an atomic bomb going off at the cellular level. Cell signaling is off at every level when you can't get good restorative sleep. That's putting it kind of very crudely, but we know that to be true.
And I chose this picture because like the guy is stressed out to me, and I just wanted to add that piece is that a lot of us are going to bed, and again, I'm going to pick on our female community. My husband, hits the pillow and he's out. I hear him already, and I'm like, get your appliance in, or nudging him, go brush your teeth and get your appliance, right? But a lot of us get stressed during the season, and that stress is directly correlated to all three of these things. Again, your brain isn't turning off many times, your glucose is spiking, your cortisol levels are high. And I say mental health because we can't turn it off. And so we know stress is actually then increasing that blood pressure, increasing that cortisol, increasing that glucose level. And so I just want to put that out there, how important it is and how that affects on other levels when we see that. And so some of you may be thinking, yeah, I could see that in myself. Again, I just want you, that's why I think having a monitor and starting with yourself is really important. So you can talk to your patients, have these conversations, because it's just like me, always looking, did I get enough deep sleep? My body, I always say, is pretty miraculous that it knows that when I go to sleep, I get my deep sleep, and I'm always like trying to get that win. What is it that I can get my REM levels, get my deep sleep levels? Because some of us who've never tracked their sleep will see that they never get into deep sleep. They're never in truly what I call that clean out mode, Dr. Gina, where their brain is actually cleaning out. And we know that is so detrimental long-term to brain health.
Exactly.
So I just put in here, so diabetes, again, I could start with sleep, and now I'm going into, I have high glucose, I'm spiking, right? I'm insulin resistant, I'm headed towards pre-diabetes to diabetes. And guess what? Now I have a 3 times increased risk for periodontal disease. We know Atrexlate increases the inflammation and it increases our periodontal. And that is a bidirectional relationship. So that's why I like to always bring that up. And then I throw obesity in here, and there's so many things, but I just want you to see with the inflammation, because many of our patients with sleep disorder, and I'm also going to say with our periodontal pathogens in that bloodstream, high blood pressure, we're now talking about inflammation, cardiovascular disease, obesity is a direct connection. And many people don't realize this. Look at this. When you have that BMI greater than 30 there, it has significant increase in the risk of periodontal disease. And it's everything we're talking about. And so we need to understand those correlations when we're looking at our patients and everything that's happening. And so I do like everyone to go visit American Heart Association, their Healthy Smiles, Healthy Hearts, because they do tell us about these bacteria getting into the bloodstream and affecting other parts of the body, mainly the heart and the lungs. But your mission and your challenge is that to print these off. They've made these great infographics. So again, I'm about implementation. And so I want to talk to my patient about how their high blood pressure is affected by sleep, which affects their blood sugar. And look, it's all right here for me. So I don't have to be writing things down. I don't have to be trying to explain it. They've given us these great infographics, and they're actually being able to tell our patient. So if you're doing these things in your office, from taking blood pressure to even doing the glucose monitor that we talked about, either the Stello for your patients, I love that, because you can even put them on for your patients and have them wear them. And then bringing it back to sleep, how that's all connected. And then again, to your pathogens, how they get in the bloodstream. This is all from our American Heart Association. And so it brings that validity, like Dr. Steve was saying, like of who we are in our community, and to be strong in what we're doing and helping our patients. So just look at that through those blood markers. We're looking at blood pressure, blood sugar, and of course you can ask them on their blood panels if they've had their blood work, where those levels are at. And so, Dr. Pritchard, you spend a lot of time on blood panels. I'm going to move on, but anything you want to add that, since I kind of threw that in there, I didn't want to throw anyone off, but one that I put on here, that ADMA on that patient. So if you look on here to the far right, that ADMA is at 106. Can everyone see that in the yellow? Can you tell us what that means? What would we be having a conversation about together?
We would just explain it simply to the patient that ADMA, which stands for asymmetric dimethylarginine, indicates that there is an impairment in the nitric oxide pathway. So we know that this person cannot be producing enough or enough of an amount for their nitric oxide to be effective. So we know they're at risk for cardiovascular disease and a whole host of other diseases. And first and foremost, we go right to airway when that's elevated. It sometimes is elevated for other reasons, but 99 times out of 100, it's an airway related issue.
Perfect. And I love that, because I like people to just see that's how we're looking and talking about all these things. So what can we do to reduce glucose and insulin levels? Who has any ideas? Well, one, we can control pathogens, right? We know diabetes, direct correlation. I'm not going to spend a lot of time, but we're always looking for those red complex. We're looking for that airway, right? We just talked about nitric oxide and the glucose and the stress. And we know they get into the bloodstream, so they're affecting blood pressure and these plaques that we've been talking about. And so I kind of want to just touch base on that of just, right, we're going to talk about strategies. And so I want to get to those tonight. But we know there's the direct pathways for cardiovascular disease in those plaques. Anything you want to stress about this? There's just one of my favorite current articles from 2023. If anyone really is questions the pathophysiology, I feel like this is the place to go if you want to really understand all of the like endothelial dysfunction, to how they mimicry, to just how there's toxins, just all the different pathways that are happening.
Yeah, and in case anyone on here hasn't heard about, initially it was discovered because some forward-thinking doctor, Dr. Pesce, said, I think there's some bacteria in the mouth that it's implicated in these dangerous plaques that rupture and cause heart attacks. Dr. Pesce somehow got people's family or the patient to sign a consent form for him to extract tissue from the site of the heart attack, the inside lining of the artery, just like Laura's pointing to there, where the heart attack was occurring, the culprit for the heart attack. And these bacteria were virulent and active and a dynamic part of the reason that that plaque was not only there, but that the plaque became unstable, more dangerous, and grew and ruptured, leading to the heart attack. And so that's led to, of course, numerous studies, none of which is less important than the initial pathophysiology that Dr. Vigorous and Bale and Doneen outlined for us, giving the three different ways that these pathogens can impact the wall of the artery. And then this article is expounded on it even more. And there are others out there. So we know that it's just like, throwing some kind of like dangerous substance, virulent substance on an open wound. These bacteria are really part of the problem in the wall of the artery. And that's, again, something we can't see, and it's at the cellular level. So we tend to kind of brush over these articles, but it's incredibly important.
And then I threw this in here, just that, right, coming up, we're going to be talking more and more. And I don't know if Anne is on here tonight. I don't think I saw her, but you're going to be hearing more from her in 2025, because there is the Alzheimer's Pathobiome Initiative. And so they're looking at the role of the microbes in Alzheimer's disease, dementias, and beyond. And that is our good friend, Anne Rice, who's working with Dr. Isaacson out of Atria Health there in New York. And so really bringing a lot of that to the table, because again, we talk about vascular and a lot of times we're focusing on the heart, but we need to remember the impact. And you're going to see more coming out on brain health here in 2025. So we're going to kind of look at a case. I was sent this case in, and I want you to take a peek at this case. This is a patient. This was sent. What do you see? So take a good look. What are you seeing going on? And then I want you to just take a look at what is going on microbially. So we have all red pathogens. We actually have the new Pseudomonas in there, very high. If you don't know about Pseudomonas, it's responsible for over 50% of your implant failures. It is the most opportunist pathogen, and we know that for peri-implantitis disease. You can go read this article out of January 2020. Very important that we are looking at these things. And so what I just want you to tell you about, it's not only very resistant in the human body, it's also in other animals like dogs, but it's also in our soil and in our water. And we saw a huge surge here, you see, in 2020 in the hospitals. So I just want you to know there's a lot of people who are carrying this, but when it comes to surgery, implants, things that we're doing in the dental procedures, and people are like, peri-implantitis, implant failures are on the rise. We really need to be looking. This is something we can't see and is having an impact. So what would we do for that patient? Would you go ahead and pull the rest of those bottom teeth and put more implants when we had all the red complex and you now have Pseudomonas? Okay, I see Amanda saying no, Cheryl saying no. A few people are like, no, Laura, don't do it. Erica's like, no, don't do it. So what would we do? What are we going to do? How are we going to intervene? Come on, girls, what are you going to do? Actually, Dr. Enrique, I'm not going to put that patient on ParaProtect. I'm going to tell you why, because it's a hydrogen peroxide and they have, I'm going to share my screen. This case, that's why this case is so cool, because a lot of people miss this. Let's go look at those. Look at how this TF is upper limits, one of the highest, and then you have very little TD and then really high PG. This is a resistant, highly resistant. You have PG and TF, which are the most highly resistant species. And you have your Pseudomonas, which is resistant. Why would I not put a chemical like hydrogen peroxide, chlorine, chloride, bleach, ozone? You could do ozone at the chair, but I won't be sending them home with ozone. Why wouldn't I want them to have some low-level chemical on the patient? Because PG and TF exchange their DNA with other species, and they will not only survive that hydrogen peroxide you're putting in there, but they're going to thrive and grow higher. So was a great thing that you said, because I want people to know that this is not a candidate. ParaProtect to me is for my orange complex and my non-resistant red complex. So this guy has very high. They could actually get higher, whether ParaProtect or it's not really ParaProtect. The trays are great. It's the peroxide. So it's really any type of chemical like that. What would I do instead? Yes, these are so high. These are in the bloodstream. So we need to not only attack the mouse. So I know Amanda just talked about this last time, and our hygienists like Michelle and a few others were pulling out all the stops, right, girls? We're going to be doing that airflow. We're going to be doing scaling and root planing, but we got to get around those implants. We got to break up that biofilm around there, or we're going to lose those implants. So we got to get antibiotics in there. And because we have Pseudomonas, does anyone know we would normally use amoxicillin and metronidazole? What would we use in place of amoxicillin when we have a Pseudomonas? If you're saying it or typing it, anyone saying it, what would we use? Anyone know? No. You're going to take this away. Quote me, date me, because that may change in 2025. But right now, the research is telling us when we have Pseudomonas, we use ciprofloxacin. So you're going to pull out the amoxicillin. Remember, we use the combo amoxicillin and metronidazole because we don't want resistancy. And we know there's 0.003% resistancy when we use the combo. We're going to do it for 14 days, but because the Pseudomonas is so high and present, and this is an implant case, we're going to take out the amoxicillin and we're going to put in the ciprofloxacin. And so that's really important because this patient is looking at these clinicians, a very high failure rate. If we would have had this test before we would have done all on 4 up there, we could have drastically helped that situation and maybe not be seeing such failure. So that is a huge takeaway. Anybody know, once we do the antibiotics, right, we got to make sure we're not putting chemical products on. So remember my top 10 from Supermouth, Super Teeth, Dr. Jen's, what else is out there? Boca, you name them. Get a good quality product that is not chemical laden. And then the most important piece is what? We got to put health back in, get those probiotics. And because you have a resistant red complex, remember, we have a monopoly here in the US. It's going to be Probi or a Pro. Once you clear the red, you could move to all the other brands. So if you were taking those notes, writing that down, but I hope you had a huge takeaway with this Pseudomonas, it changes the game. Your treatment will change. And a lot of our clinicians are missing this on their implants and surgery cases. It is one of the leading causes of failures. All right, Dr. Gina, wrap us up because we're going to throw out a challenge. What can we do? We started with some biohacking with sleep. We got to wrap it up. So what can we do? Some of these top 10 things.
So I would say one of the top 10 things that we can do for the holidays, I'm just going to say, and someone said it, I think maybe it was Allison in the chat earlier, try to eat only or try to start with protein. I know we haven't really talked about blood sugar a lot, but if we eat protein also, if we are going to eat late at night or if we're going to eat our evening meal, if we will eat protein, that'll not only also help with sleep because of the stabilization of blood sugar as well, and just keep those carbs out of your diet or eat very few carbs. So it's for us, Lora, we want people to eat real food first, nothing that you can't recognize as meat, fruit, vegetables, nuts, and oils that our body will recognize, not any fake oils like canola, etc., but protein. So one of my hacks is eat protein.
So what's that food order? I'm going to go to my Christmas or my Hanukkah parties and everybody's having a party. What is the food order? What should I put in first, second, third? What would you tell me as I walk into the party? Lora, do this. This is one of the biggest biohacks that you could do.
Yeah, go right to the charcuterie board. Avoid the crackers, avoid the honey, whatever dried food that's on there, but eat the meat and the cheese. Yeah, eat protein first. That seems to work the best for most people. Now, some people will eat veggies first or veggies with vinegar or eat their salad first. And you don't know without a continuous glucose monitor, but that can work. And if you have no other choices than anything that's got fat, start with fat. Start with anything but a carbohydrate.
And so I think that's so important because actually, what do we usually go for first? We go for like the cracker, the cookie. I'm just gonna steal this like chip. And so I just think that's such a great hack because I'll even like, where's the olives, right? A healthy fat where something has avocado on it. And so it could just be even a couple bites. Like I was told our patients, give me 5 broccolis with vinegar. I know you don't want to eat vegetables, so give me 5 broccoli with vinegar, then get that protein and fat. And so then our carbs and fruit is dessert, right? So our fruit is last and then that sugar. I want the piece of pie or I want those cookies. Somebody made those Christmas cookies and I want to eat them. When should I eat those?
Yeah, right after you eat your meal. Yeah.
Say that again. When?
Not by itself later. Don't say, I'm going to visit a while and have that in an hour or two. Eat it right after you've had your meal because then it's close to the protein, fiber, and fat that you've already put in your stomach. And so it's not going to spike blood sugar as much as if you wait a while, then the stomach is emptier again, and then you have the sweet.
So important, but I forgot that and I started talking. What should I do? There's nuts on the table and the cookies. What should I do?
You should go with the nuts.
I should eat at least a couple of those nuts and then put that cookie in there. All right. So I want everyone to do those hacks. We know that, a lot is foodborne, and to look at that. We talked about focusing on those micronutrients. I just want to wrap up really focusing on those cofactors, Dr. Gina, that you talked about, the B
Yes.
complex, that B12, there's our K2, D3, and there is your top one, protein. What would you say the average patient comes to us that is not eating enough protein, you see on blood work?
Well, we see that they're insulin resistant. We see early stage prediabetes on a multiple readings on the lab test, because we look at it in a variety of ways, and it may be something as simple as their liver enzymes are trending upward. Well, they're moving towards fatty liver disease, so we know that they're not eating enough protein. There's several clues, but that's one of them.
I would say like 90% of our patients. So I just have to throw that out there. People think they're eating enough protein, and they're not. And it's just like you said, we see all of that connected. So our CoQ10 just so important for that heart muscle, heart health. I know you talk a lot about that. The sodium, a lot of us are missing those electrolytes, the magnesium. I just had to throw grounding in there in our circadian rhythms. I just think a lot of us aren't getting like light therapy. We don't get sunlight on our face, right? We're in front of the computer, again, affecting our sleep, and we throw off our natural rhythms, and we're not really getting back to where we should be. I just want you to wrap up with the last two, 9 and 10. You've been doing these tell me about these farmer.
Yeah, so there are so many great exercises, and we know that, like, you hear a lot in longevity medicine about VO2 max, our cardiopulmonary fitness being a measure of longevity. It is one, that's for sure. So people that are saying just lift weights and throw some cardio out the window, that's not true. But we also know that there's an epidemic of people who do not have enough muscle on their body. And so, yeah, there's HIIT exercise is a short way, high intensity, short intervals, twice a week to really get cardiopulmonary endurance. But you really need to do just a brisk walk or even a slow jog, or maybe be on an incline when you're on your Zoom meetings, and get 20 or 30 minutes of breathing moderately hard, not just a stroll, to get that cardiac fitness, cardiopulmonary fitness. But we need to be building muscle at least 3 days a week. And I do it at home a lot of times with, Laura mentioned farmer's carry, like just getting heavy weights and walking around with them for a minute. That is associated with longevity. Also, just hanging on a bar and trying to, build up to not only just hang there as long as possible, but then, a chin up or two, or even more. And then you can easily do squats at home and build those big muscles in the glutes and in the upper legs. See how many you can do while the coffee's making, and then see how many you can do, I don't know, between Zoom meetings, or just pick a time, and do them all throughout the day. So those are some easy ones just to fit into your day, I would say. And then number 10 is way like under, what am I trying to say? We don't talk about it enough, because we've seen a lot of people that are doing some things wrong, in terms of, okay, this is going to sound awful, but maybe even smokers, or maybe even, their blood pressure is higher than whatever it should be, or whatever. Yeah, we're going to work on those things. We are not ignoring those things, but we've seen some people overcome some health challenges just because they have supportive relationships, they have a positive outlook on life. They seek out joyful, blissful opportunities, and they put their stressful situations in their proper place. So there's something to be said for being good to yourself and enjoying life.
What about yoga?
And yoga, oh, absolutely, that falls into both of those categories. It's 9 and 10. Great idea.
All right, so this is everybody's holiday challenge. Take a look at those top 10 and write down right now, what are the 3 you can do? Write those down. What 3 could you commit to during the holiday? For me, I focus on food order because I'm going to eat the cookie, but I want to make sure I'm not spiking and baking, glycating. So I'm definitely always choose food order. I'm going to tell you the farmer's carry. Dr. Gina's got a challenge with even the grips. We could all do some gripping, right? We know that's a longevity thing. You can't hold on or grip. Is always a good one. And my sleep is always going to be a top priority as I age. I feel like we cannot underestimate quality of sleep. So those are my three. And so we're throwing out this challenge for all of you for the holiday to pick those three. I say continuous glucose monitor. It is life-changing to see what your body responds to, because we could all eat the exact same meal on here and we could all respond very, very differently to the exact same meal. Look at your sleep, start with yourself. I save and track your blood pressure with that. I have low blood pressure, but it's amazing when I get good sleep and I'm not spiking, how nice and calm I am inside. So choose some of those biohacks. We'd love for you to then post. We're going to be in our Instagram. We're going to post that in there. And so people can comment, can add to, we can see what's going on all together, and love to help each other through the holidays. So I just want to end with that we all have a massive opportunity. Dr. Steve was right on that we can all come together to make a positive impact, not only to earn higher revenue, because we are in a business of making people healthier, and you can actually give your patients the health they deserve. I say start with ourselves, because we are also our own patient and we need to treat ourselves very kindly. So thank you, everyone. If there's anything in the chat, love, we're here to answer any questions. So great. Dr. Gina, take it away.
Couple of things. So Laura, just clarify that metronidazole is still on the table even when you're doing the combo, correct? There's a question about.
Yes, if you have red complex with Pseudomonas, it is the combo of metronidazole you're just putting in now with ciprofloxacin, as if they had an allergy. If you had an allergy to amoxicillin, you could use ciprofloxacin. So you're just exchanging it, replacing the amoxicillin piece with that. But if you didn't have any red complex, I'm going to challenge you on that. What if I didn't have any red complex? You don't have any PG, you don't have any TD, you don't have any TF, then you could just go with the ciprofloxacin to attack the Pseudomonas. And that's very important in your implant cases.
Okay. And is Pseudomonas tested in the oral salivary testing? I know it is in the Spectrum Simply Perio test. Any others that are doing the Pseudomonas that you know of? Any other options?
It depends. I think that Bristol can pick it up. I don't know what their count is, and same with Viome. Those are two public ones as well. The issue is at what level. And so right now we know that Simply Perio is the only one that has it at that low level for periimplantitis.
Okay. And then Diana D comments with many exclamation points, carnivore. Yes, you're my sister. If we all just went carnivore. I don't know. I've been trying it, and it's I've tried it for several months, and I'm kind of on it, off it sometimes now, always keto, but you're right, carnivore, you don't have to worry about the carbs. You don't have to worry about, am I getting pesticides from the vegetables? So I agree with you there. And then there was one other increased protein.
Dr. Gina, if you're on here, I'm going to say you yelled at me, but I was vegetarian, I was vegan. Can you just speak to that? Because I'm going to go back 5 years before I really started working with you. And I mean, Dr. Gina had me like, look, you're killing yourself. Can you explain that? I mean, now we did my genetics, so I'm an APOE2, so I shouldn't be, I need to be more of a carnivore, fat and protein, but even just looking at my blood work, can you kind of speak that? Because that hurts like my 5-10-year-old brain. I'm so indoctrinated that you need to be eating all these vegetables. And
right.
but most of us, I was a cheating vegan, that means guacamole and chips, guys.
Mm-hmm. Yeah. Yeah. Well, that's one issue, is that vegan and vegetarian isn't necessarily healthy, because you can have French fries, and be vegan or vegetarian or whatever. But when you look at genetics, very few people, there are some that have a genetic makeup that vegetarian or vegan can be healthy in. And there are a lot of people that are vegan and vegetarian for spiritual, religious reasons, for ethical reasons. And so it's everyone's choice. There is no one diet for everybody. There is not. So I'm certainly not saying everybody needs to go carnivore, and I'm not saying everybody needs to go keto. That's not what I'm saying. I just got excited there when Diana is trying it too, apparently. And there are nuances to all of them. But when we saw Laura's genetics, we knew right away that she was not one of those few people that could live a healthy, long life and, maintain brain health, cardiovascular health to the bitter end, or to the blessed end, to her last blissful breath. If she stayed as a vegan or a vegetarian based on her genetics. She needed more fat. She needed more protein. And it was hard to get. That's a main problem with vegan and vegetarian, is that it's hard to get enough protein. You have to eat a lot of soy or tofu. You have to drink a lot of protein shakes, and that's just not a high quality way to get your amino acids and proteins. But all of that's workable. So we're not saying nobody should be vegan or vegetarian, but we're saying very few people can really live a healthy, vibrant, high performance life that they want to live as a vegan or vegetarian. So that's funny that you bring that up, Laura. But yeah, your genetics were screaming, eat some meat.
Well, just my blood work, guys, just
Yeah,
looking.
even the blood work. You're right.
Yeah, my magnesium, all my electrolytes. I just think we kind of skip over that. And I'm just admitting again, I think learning from other people's mistakes just like beat into my head, like, oh, you have to do that to be healthy. And that's not necessarily the truth. So I just kind of want to work against that dogma a little bit, because I was living with that. And so I do cheat with veggies. Yeah, veggies are, should be our cheat, right? Get in the healthy things. But I think just what you talk so much about, Dr. Pritchard, is eating real food. If we choose nothing else.
Exactly, right. And I think anyone on the study club tonight that's doing inflammatory markers or micronutrient testing of any kind, vitamin D, magnesium, etc., you bring up a good point, because sometimes it's a clue in the diet when you just have these inflammatory markers that you've looked at everything that could be elevating it and you cannot get it down. Then it's time to take a fine-tooth comb to the diet, especially if you see some of the micronutrients out of whack or insulin glucose out of whack, like you've talked about. One other person said, what's the best sleep tracker? Okay, like Lora said, well, Lora, you answer that. As far as an over-the-counter wearable, I would say they're all fairly wimpy. Like we can't really get the nuances that we need as clinicians. But if you've got a wearable that's telling you that the oxygen average is 96, 95, 94, whoa, anything lower than that average to me gets my attention. Any irregularity on the wearables, breathing irregularity, and most of them are doing at least those two variables now. And then we love the sleep image ring. We love the watch pad. It's just you can't wear it as many nights as you can the sleep image ring. What else would you say in terms of sleep tracker?
I want Dr. Steve to talk about this. This is his area, and I know him and Whit do a lot of the same things. So Dr. Steve, if you could unmute and tell us.
Great.
Absolutely. I was just putting something in the chat there. Hang on, let me.
Oh, good.
Staring. So right now, the one I like the most for just SpO2, you just want to track this, is the Circle Plus. It also has a little springy bit that monitors blood pressure. So I'm not sure it's as good. It's probably not as good as something like you would, wrap around your arm, but it measures blood pressure. And so how often do we get a chance to see that? And so that's pretty good. There's a new one, brand new one called Happy Wellness, which, funny name. It's out of Austin, but Happy just got FDA cleared to diagnose sleep apnea off of a ring. And it's a ring the same form factor as the Aura ring. So it's that small. It's not like a sleep image ring, which, by the way, I love sleep image. I think that gives us a lot of data that we can work with our patients. Mm-hmm. But the Happy ring is a new one. You can find it with just Happy Wellness and type in sleep apnea ring, because unfortunately Happy is is too overused. So Happy Wellness sleep apnea, and you'll find it. And it's a system where you get the ring and you use it for a few nights, you can send it back and you get a report. So it's not a continuous thing. They have sleep doctors that work with them. And so it's a pretty good, helpful time-to-time ring. Now, one of the things we have to guard against is having our patients become what's called orthoapnea, which means they're obsessing about their sleep quality, their sleep numbers. And so that's another unhealthy part living, is when you're worried that your SnoreLab app is giving you an 8 and it used to be a 6. You know, so we got to be careful about that too. Yeah.
I think that's such a good point. And thank you for those recommendations. We'll look those up. Those sound very exciting.
Mhm.
And I'm also glad with you that that you made the point that you just did about obsessing over the data, because we've had some patients who have done that. And you started with a story that brings us back to what we ended on that last slide, talking about the stress and the joy of life. So if we would focus more on the type of activities that you did, taking the dogs to your blind friend so that she could see the dogs when she still had a little bit of vision left as your activity for the holidays, the joy that that gave you, the joy that it gave her is far better than eating a piece of fudge at the dinner, you know, or concentrating on the pumpkin pie or whatever, because it's positive for your health. So my whole point about that is, if all of us would approach the holidays, this is another hack, with how wonderful we get together with our loved ones, how wonderful we get to do lovely things for other people and other people do lovely things for us, and enjoy those moments more than focusing on the food. Although I know food has a strong cultural and a strong emotional and a strong, you know, history to it. So I'm not saying we should, you know, all fast and go get together for the holidays. I'm just saying, let's focus more on the relationships, and that will be better for our health. So thank you for starting and ending with those. You started us well, and you ended well.
This is a fascinating meeting. I've loved every minute of it. So
Oh, thank you. I did
yeah.
too. Laura, good job with the slides and with the approach. Really excellent.
Well, Dr. Steve, you're going to have to pick a date, because I know a lot of people in here want to hear more from you and what you're all about. So we're going to be coming to you. That will be in 2025. Everybody, I thank everybody for being on. Happy holidays. And again, find joy and love in everything that you do. And hopefully we'll see you guys on our Instagram. Can't wait to hear how things are going. Have a great night.
Good night.